Hi, I'm Karen Schulz, an RN at CVICU at CHI Memorial Hospital, and I'm going to talk to you a little bit about what to expect as a patient. We are an 18-bed cardiovascular ICU, and most of our patients have coronary artery bypass grafting. You may hear it referred to as CAB or cabbage, even sometimes people will say. When you arrive straight from the OR, the operating room, several nurses will be in the room to help assist getting you tucked in and settled into our room, connecting you to the monitor and the different IVs and all the different equipment that we have. You will be under anesthesia still. They don't reverse that, they just kind of let it wear off, so you will wake up in a few hours. During that time you will be on the ventilator with the breathing tube in your mouth here, just until the anesthesia wears off and you're able to do the breathing, and then we will attempt to get that breathing tube out as quickly as possible. Our goal is less than 6 hours, but most patients we can do it in maybe 2 to 4 hours. Try to stay calm and relax and just take slow, deep breaths. Other equipment that we will have, you'll have a big IV line in your neck over here on the right side that is connected to the heart catheter, where we can read pressures on the screen and manage your vital signs, basically, to keep you stable after surgery. You will have drainage tubes from your chest where they did the surgery that will be connected to some canisters on the bottom. You'll have a Foley catheter in your bladder that will drain your urine, so you won't have to worry about that. Blood pressure cuff that will pump up fairly frequently, at least in the beginning. You'll be, like I say, on the monitor, so we'll be in the room with you and monitoring everything pretty continuously. All of this getting you settled in takes about 45 minutes to an hour. They'll also do an x-ray during that time just to make sure that all the tubes and wires are in the right place. And then we will allow your family to come back and see you. Usually we let everybody come at one time and we kind of give them an orientation to the unit, what to expect. So we'll talk to your family for a little bit. We'll give them a privacy code and phone numbers that they can contact us even during the middle of the night if they want to, and just kind of orient them to how things go in the ICU, how your status is, and kind of what to expect the next day. You'll have a lot of different IV bags and lines hooked up, but not everything is going at once. We have medicines for in case your blood pressure goes up, in case your blood pressure goes down, things like that. So you'll have tubes and wires, and you have a big cut on your sternum, so there's not any way to totally get rid of it, but we try to maintain your pain level at like a 2 or 3 on a scale of 0 to 10, 10 being the worst pain. So we have pain medicines that we can give you pretty much every 4 hours. In the beginning, if you need IV medicine, we can do that even more frequently. Something that you can do to help with the pain after you're off the ventilator, to do the incentive spirometer or that little breathing exerciser, and that kind of helps exercise those muscles so that the soreness and the pain gets better quicker. We'll be getting you up in the chair by the first morning, up for every meal, and that will also help. And we also will, unbelievably, ambulate you or walk you in the hallways the first day post-op. And that really helps you get better and get out of our unit and get back home as quickly as possible.